Anita, this was over the weekend, and the first confirmed case came back Sunday. 28 employees have since tested positive at the United Poultry Company on the downtown east side. Take a look. And today we saw a total of 25 new cases province-wide. Now, the reason for that 3-case discrepancy is that some of the staff at this plant who tested positive were counted previously in our briefings like yesterday, and we'll likely see more confirmed cases connected to that cluster in the coming days as well. Now, we've learned 4% of BC chicken is processed at this facility. Poultry farmers don't believe this will majorly affect or make a big dent in the supply for the province. The plant was inspected yesterday. It's now been shut down, and an outbreak investigation is underway.
No, there will be concerns about the products that have come out of this. So this is a chicken processing plant. We don't have any evidence that COVID-19 can be spread from meat and from consuming of products like that, or from packaging on meat or chicken in this case.
Now, there's at least one other facility in BC that's owned by that same company. It will also now be inspected. And she points out these are federally run plants monitored by the Canadian Food Inspection Agency. And part of the requirement is that they have a coronavirus plan in place.
We'll be keeping a close eye on that, Tanya. And also, yesterday we took a closer look at what restaurant reopenings might look like. What about important but not necessarily essential services?
Yeah, that's a big concern for many. What about things like physiotherapy, dental appointments, eye checkups, all of those kind of in-between services that may not technically be deemed essential but are still critical for many people? Well, today Henry said it's important to bring back those things as soon as possible, especially those recovering from surgeries who need follow-up. She suggested there is a world where that can happen, but perhaps a modified version of what we were used to. So the key, she says, is to be vigilant at home and at work for any staff at those places so that it doesn't trigger a surge in community spread.
It may mean that we have people coming in at set appointments. We may not be able to see as many people in a day, but we have to do it in a way that we have the appropriate protections in place. We have hand hygiene available. We have separation for the reception staff, for example, for people sitting in a waiting area, making sure that we can have this, minimize the number of people.
Now, also interesting, Henry was asked how and when we might see a vaccine rollout here. She says there are plans for max vaccination clinics across BC when the time comes, still months away at least. But she doesn't think immunization would be mandatory in BC. The top priority for that would be healthcare workers, seniors, and anyone who is immunocompromised. Anita, Mike?
Tanya Fletcher live for us tonight. Thanks, Tanya.